Hi, fellow data and AI experts. I am Adit Falak. I specialize in cloud scale analytics and distributed machine learning, and you can catch my session on small file syndrome tomorrow afternoon. I'm excited to join you all from Tel Aviv. For our first talk, I'm going to turn it over to Patrick Kendall, co-founder and VP of Engineering at Databricks.
All right, hi everyone. Welcome to a conversation with Michael Lewis and Charity Dean. I'm Patrick Wendell. I'll be the host of the session. I'm one of the co-founders of Databricks, but today's really not about me. It's about our two speakers who are here to talk about Michael's new book, The Premonition. And I'm gonna get started by introducing the two of our speakers. First, we'll start with Michael. Many of you may know him. He's an author of several best-selling books, some that I remember because I've read Liar's Poker, Moneyball, Big Short, Flash Boys, and most recently, Premonition. Michael, thank you so much for being here.
Well, thanks for having me.
Yeah, and Charity Dean, who you may not know, but you will know if you read the book. Charity, we know you in the book as first the public health officer for the County of Santa Barbara, and later the assistant public health officer for the entire state of California. I would say assistant in name only, more of the lead health officer. And I believe you've since left the public space to found a company called the Public Health Company. We don't see that in the book, but I think it's happened since then. Thanks so much for being here. Really excited to chat with you today.
Thrilled to be with you.
Yeah, awesome. So for those who don't know, the new book, The Premonition, only came out pretty recently, so you may not have read it yet. I've speed read it in the last few days, so I'm happy to be interviewing you two about the topic of this book, but also I would say sort of data-driven leadership more generally. The book is really about the US government's response to the COVID-19 pandemic as viewed from a variety of different vantage points. I'm curious to get us started. Michael, tell us, how did you stumble upon this area? You haven't written extensively about public health in the past. So so how did you get involved with this cast of characters in the book?
All right, so I'll tell this story through a little bit through the data analysis prism. But it started because I'd written a book about the federal government as a manager of existential risk, called The Fifth Risk, and it was kind of looking at what happens if the people who are running the government are letting these risk management tools corrode or are indifferent to them. And it was in the course of working on that book, if you had been a fly on my shoulder, you would have emerged terrified. You would have said, this is the only tool we have for dealing with certain problems, and we're not taking it as seriously as we should. And the question is, like, in my mind, was like, only what's going to happen, not is something going to happen. And so when the pandemic occurred, it was a natural sequel, which is not a good reason to write a book, but it was the natural sequel. But as a result of kind of being, everybody asking me, are you going to write about it? I started poking around, looking for what is the story here? And the story pretty quickly emerged that this is the story of the US response, that with a little bit more than 4% of the world's population, we have 20% of the world's deaths. And I mean, kind of most interestingly, going into it, that you had, panels of experts before the pandemic ranking countries by their pandemic preparedness and ranking the United States #1. So it started with this question, like how were we so well thought of and obviously so materially prepared and did so poorly? So that was the beginning of the story, and it led me in a lot of directions. And part of the story is absolutely a data story, but it led me eventually to charity, because one of the answers to the question was that we actually have misidentified who the experts are, who the people are who we should be listening to about this, and that we have people who are relatively low status called local health officers, whose job it is to respond to communicable disease and who have been fighting battles and who could tell you a lot about what's wrong with the system we have for fighting a big communicable disease. So it took some months, and it took a realization that I had a handful of characters who were absolutely riveting. But it ends up being a story that in which you see these people who are kind of have a privileged view of both the pandemic and the public health system, fighting to save the country from itself, and not really succeeding, but at the same time revealing the problems in the system. And one big problem in the system is incredibly inadequate data. So that's how it starts.
Yeah, absolutely. And to your point about characters, I love how character-driven this book is, as all of your books are. And Charity, you are one of the main characters of this story as a public health officer and someone who's sort of seen the system at several different levels. I thought I would maybe start by asking you, my view of public health and the pandemic response going into the book was that you had some guy at the top who I thought was Dr. Fauci. And he kind of was this omniscient guy that was making all the right decisions. And presumably he has some amazing command and control structure where, when he says go left, there's a series of a hierarchy below him that can really quickly execute in a particular direction. And boy, I was way off after reading this book. Would you mind telling us a bit about how the public health system actually works in the United States, both in general and how things sort of worked during the pandemic response?
Sure. Well, and I think the way that you thought of it is very common. I think most Americans assume that there's someone in charge and they can pull levers and activate the frontline troops. The way it actually works is shocking for people that aren't familiar with it. And really, the system that we have in the US is kind of a relic from the last century, where it was assembled together based on local public health departments. So across the US, there are about 3,500 local public health departments. And, I was a local health officer. And so each one has a local health officer, and they are in charge and they make decisions of how to contain things on the ground and what data points they're going to pay attention to. But importantly, they're all appointed by a board of supervisors or a county commissioner. They're all political appointees. And so the information from the community, let's say you have a school that has, let's say, 5 kids with rashes and their vaccination rate is low. So it could be measles. So the information flows by phone calls and faxes into that local public health department, who in many cases files it in an actual filing cabinet with actual paper, not digital or electronic. And at some point sends that information up to their state public health, who compiles that information from all the different health officers in their state, and at some point shares it with the CDC. And then months later, we get, as a country or academics, information on what happened. And that's how the current system works. And so each local public health officer, like you'll read about in the book, is kind of on their own to figure out how are they going to contain diseases, and in many cases, diseases that no one else is seeing and no one else is worried about in their domain. And oh, by the way, they can be fired very quickly because they're political appointees. And so it's this delicate dance you do on the front lines of being, really like on the battlefield with your team without air cover or much support, and owning all the responsibility for whether someone in your community lives or dies, whether you stop the outbreak or not. So that's really what the current system is today.
Yeah, and it was just striking to me how you couldn't think of a more poorly designed system in the event of a sort of global pandemic that requires heavy degrees of coordination and alignment across the entire United States. I'm curious, I believe you are in the California Public Health Office when the pandemic occurs, right? I'm trying to remember the exact sequence in here. And I know Michael follows a separate group that you eventually connect with, but when the pandemic starts, what is your take on how things are going, and how did this apparatus respond when the first signs of pandemic occurred?
Sure. Well, I hear all the time, I hear people say when the pandemic hit, as if it's like a meteor out of the sky that nobody could have seen and boom, it smashes into the earth. That's actually not how outbreaks start. It always starts very quietly with a health officer who has suspicion based on scattered information from sketchy sources. And so in January, watching some of that scattered information on Twitter or some of the scattered news reports coming out of China, I was highly suspicious and was doing the math on my whiteboard and asking myself what kind of pathogen would cause China to behave like they are. And inside the state of California, there was certainly discussion around the news reports. But the problem, and this goes back to your point about the public health system, what is it? Is that the states in large part wait for the CDC to act. And so there was this waiting and this waiting and this waiting for the CDC to say, we should all be terrified and we should implement restrictions right now. And that just didn't happen in January. It didn't happen. Not only was it quiet, but there was no sense of foreboding or worry or math, quite frankly, from the top federal levels.
Yeah, it's so interesting. And Mike, I'll get back to you, I promise. But I think
You don't have to.
really
No, I'm enjoying the show.
She's really the hero of the story. So just one more question on that. I mean, it's clear that your view in the book is that the CDC acted too slowly and they ignored obvious signs that this was going to be a quite serious issue. Why do you think that was? Is it risk aversion? Is it fear of being wrong? Is it that they don't have the data? What's the underlying cause in your mind about this kind of sort of tragically slow response?
Sure. And I've thought a lot about this because of just years of experience with the CDC. And I would say it's really important to not blame people and not look at a person that made a bad decision or a person that lacked integrity. It's really a systems problem. And to be honest, as Michael was writing the book, he would ask me, why does the CDC behave this way? Or what happened to the CDC? And I kept saying, I don't know. I don't know. I was born in 1977. This has always been my experience that the CDC it functions more like an academic institution writing a paper, where before you write a paper, you better be really darn sure that you have all the data, that it's statistically significant, that no one can poke holes in the conclusions that you draw. And so the CDC behaves that way. And in some of the stories in the book, the outbreaks I ran, I realized, about 10 years ago, no one was coming to save me. I was going to have to put my own neck on the line. I knew the right thing to do, not just in my head, but in my gut. But if I did that, and if it was based on incomplete data, not only would the CDC not back me up, but they actually said to me a few times, we are going to put it in writing that we did not support this thing you're about to do. And so when January rolls around and I'm watching, doing the math and looking at the reports out of China, I knew how the CDC would probably behave. And every local health officer who's been in similar situations knew it too. We'd talk about it frequently, that if someone was going to lead this, it was probably going to have to be a brave local or state health officer. And Michael dug in and figured out why. And I heard the story when he found it, and I was overwhelmed with the story.
Yeah, great. And I want to put a pin in this thing you brought up of making decisions with enough data and trading off the completeness of data you have versus the urgency of making some decision. Certainly your view is the CDC biased way too much towards waiting for absolutely comprehensive data when the data you had seemed pretty compelling already. I want to put a pin in that though, bring it back in a minute, because another thing you mentioned is that you as the kind of on the ground health officer ended up playing an important role here. And it wasn't just you. There's another group that Michael follows that you end up intersecting with at the end of the story. But I love, Michael, for you to talk about these other kind of similarly sort of maverick kind of outcast group of characters that you come in touch with, the so-called Wolverines. Tell us about that group and how they contributed to the story.
Well, I was as astonished as Charity was that there was this group of 7 doctors interestingly placed in and around the federal government who were running a kind of shadow response to the pandemic after they'd realized that the federal government wasn't going to run a really coordinated response. And these people, I mean, they were not insignificant people. One of them, Matt Hepburn, it was in charge of vaccine development in Operation Warp Speed. Another, James Lawler, runs a medical clinic in Omaha to which is sent people with exotic, scary diseases so that they can treat them and understand them, and who received some of the early COVID patients. There were people who were interestingly placed and who had a lot of information, but didn't have their hands on any kind of lever of power. And the man who's kind of at the center of this group is a former critical care doctor named Carter Mesher. And the way the group forms is most of them had worked together in either the Bush White House or the Obama White House. But Carter Mesher, along with one of the other members of the group, Richard Hatchett, had been the inventor of the country's pandemic strategy. Had back in 2006 attacked this problem. These two doctors attacked this problem, and the problem was, what do you do when a virus appears and is spreading through the population before you have a vaccine? And it was news to me, really news to me, and seemed kind of counterintuitive that the conventional wisdom right then in the public health community was there wasn't much you could do. That 1918, the experience of 1918 showed that all these different cities instituted all these different kind of social distancing measures, and still the disease spread everywhere. This is the way of telling you who these people are. These two doctors go and re-examine the historical record and show that in fact the interventions worked. That in fact that St. Louis has a fraction of the death toll of Philadelphia in 1918 because of the timing of the social interventions in relation to the arrival of the virus in the city. And they persuade over a period of a couple of years the entire public health community that these strategies will work. And they give you hope. They give you a package of a box of tools that you can open if you have a pandemic. And then they embed it in the CDC. They leave the CDC believing it's their idea. And the CDC spreads this all over the world. And if you talk to knowledgeable Australians about why Australia contained the virus, there's basically no virus in Australia right now. There are rock concerts in Australia. They'll say, well, the CDC taught us this stuff 15 years ago and we used it. So these are people whose work was not of insignificance. They saved a lot of lives. They just weren't listened to here in the way they should have been. And they are in the early stages of the pandemic, parsing information from Wuhan to figure out what the hell's going on. And as a data story, it's a riveting story because, as Carter points out, at the beginning of, and as Charity just said, at the beginning of any disease outbreak, you got to have a kind of clairvoyance. You got to accept a good enough solution and don't think you're going to get a perfect one. You're not going to, by the time you have perfect information, it's too late. So you've got to know when you have enough data to act. And Carter Mesher is digging into Chinese morgue data to figure out what the actual death rate is in China. He's taking Chinese websites and putting them through Google Translate to figure out, the transmissibility of the disease. And this is a really important point. And the World Health Organization just today released a paper that amplified this point. It was known by Carter Mesher persuasively on January 20th what was coming. And from January 20th to the end of February, when the CDC finally acknowledges this is actually a serious problem, was a wasted month that cost all kinds of lives. And it was wasted partly using data, or the need for perfect data, as an excuse. So I see this whole thing as partly a data story, in that people making a fetish of the perfect answer getting in the way of a good enough answer.
Yeah, it's such a great point. And coming back to what I was talking with Charity about, there's a lot of leaders in this audience that their job is to make data-driven decisions. And when you look at a pandemic, it's such a natural data problem because it's all about modeling exponentials and different properties of growth. But one property of exponentials that's extremely scary is if you act even a bit later than you should, you're really hosed. So you get this kind of dynamic where data is your friend in that it can help you understand the growth, but it's also your enemy in that you probably don't have time to wait for perfect data, or if you do, you do so at a serious detriment to the public health. So I'm curious how that dynamic played out here. And it's not only the pandemic where this comes up. There's several other examples relating to outbreaks earlier in the book. And I guess what's your advice for, maybe I'll ask you first, Charity, what's your advice for leaders they're trying to be data driven, but they also need to combine intuition and common sense about when to act and not get handicapped by the need for data as well?
Yeah, I think my advice would be trust the people that have been around the topic long enough to be able to smell it. That sounds warm and fuzzy, but it's not. That, really the intuition of a trained disease controller or a trained frontline battlefield commander, trust that intuition in the person who's got decades of experience, because you're absolutely right. As a local health officer, I would play this game with myself where I was trying to train myself over a number of years to make a decision with less and less certainty. And I came down to these decisions I call the 51-49. And every time I'm really mad that I only have 51% certainty. And I say, I want 60% certainty. But the goal of the game over the years was to identify those scenarios where I was only 51% certain. And importantly, that 1% wasn't going to change. In other words, how brave are you willing to be when you know you have enough data to make a decision and you know what your gut is telling you? And the people that have that expertise, that have been doing disease control or whatever it is that a decision they have to make, trust those people, because they're going to have a pretty good honed instinct. If it's 30% gut instinct, make sure you find the people that have been doing this for a long time and then trust their instinct.
Yeah, absolutely. And I think you used the word brave. And I think that's such an important part of leadership here, is the constitution to make those decisions and to make them decisively when, someone could reasonably criticize the decision, and they could say, hey, you don't quite have as much data, as we might need for a sort of scientific bulletproof argument. Yeah, and that bravery really shows in the book, Charity. I'm quite impressed with your decision making, and there were also times though when you made decisions that turned out to be wrong. I could imagine that's hard, and it might influence the way you make decisions in the future.
Sure. Well, let's talk about this story that Michael told about the Montecito mudslides, where there was this very well-groomed long-term care facility, essentially nursing home or assisted living in the hills of Montecito. And it was beautiful. And the first mudslides came down the hill, wiped out the whole town of Montecito. 23 people died, but it came right up to the door of that facility. Well, the weather forecasters, who were incredibly accurate, predicted another one was coming in 2 weeks, and that it would wipe out that facility where there, were about 65 people living. But based on some dirty math and rough estimates, I gave that a 20% likelihood in my head. So there was a 20% chance 100% of the people die, 20% chance. Or if I evacuated the facility, there was a 100% chance that 5 to 7 would potentially die as a result of having to move. And I had to make that choice. And I had less than 24 hours to do it. And I knew the answer in about 3 minutes. And the reason I waited is I didn't like the answer. I knew what I had to do and I hated it, but I knew the right thing to do. And after directing them to evacuate the facility, the storm never came and 7 people died.
Yeah, it's such a striking story. And one could imagine, that being very hard for you as you kind of go forward in having the bravery to continue to make what, based on the data, is the right decision. How are you able to get through that, I guess, is my question.
I do an after action with myself after every hard decision. And the reason I do an after action is to ask myself, in that moment when I was making the decision, how much data did I have? How much did I trust it? And how did my gut feel? So that I can get better and better at making big decisions faster and knowing when I hit that point of having enough data. And the after action with, myself and my team after that was 100%. I made the right decision and I would do it again. I would do it again.
Excellent, excellent. So it's kind of a retrospective postmortem, so to speak, on the decision itself. I mean, there's so much probability in these decisions we're making that it's important to distinguish the quality of the decision from the actual outcome. And it sounds like you contend that the decision was correct. So let's see. So we're running a little low on time. A couple more things I want to get to before we wrap up. Michael, I did want to ask you, I thought a bit about your career looking at the application of data in so many fields. I think one of the early things you reported on was sort of the quantization of the finance field. And suddenly every PhD in bioinformatics or any random topic is now sitting as a trader applying mathematical modeling. What this conference represents in some ways is like the expansion of that to a much broader array of industries. And in the last 20 years, not just finance, but many more conventional industries have started to employ data science and statistics and mathematics. And that's at Databricks, what we see every day in our customers is this kind of data revolution across a wide swath of the global economy. And I'm kind of curious, you've seen data used for good and data used for evil. I'm not sure your overall view of the quant revolution was that it was an amazing thing for the world and for the finance community. So what are your lessons as you see people becoming more and more data centric? How do we use data for good? How do we avoid the pitfalls that have happened in other industries?
Just because you're doing it with data and it's all very complicated doesn't mean the old moral questions go away. The old moral questions are still there. They're just obscured from general view by complexity. So that's what happened on Wall Street, right? That Wall Street went from being, way back when, the old JP Morgan days, actually opaque, like people having their private conversations in oak panel rooms where nobody could see in, to seemingly transparent, like the walls are all glass, but what's going on the other side of the glass is so complicated nobody can understand it. So the complexity of the data revolution was the new opacity. And when things can't be seen, bad things can happen without anybody really paying any consequences or being able to correct for them. So you get the same problems, the same good and bad behavior that you did before the data revolution. It just comes in a different form. When I think about people using data to change the world, it actually isn't Wall Street I think about. I think those changes are in some ways much less profound than where it's happening elsewhere. And I think the Moneyball story is a better story. And it's a story that ports more into other industries. And what I love about that is data is enabling you to see truths that were previously hard to see. Enabling you to see the value of a human being that was previously invisible, and to judge people more fairly. And that story that a team can come in an industry as old as professional baseball, where people are doing the same job they've been doing for 100 years, with millions of people watching them and plenty of statistics attached to their performance. And simply by finding better statistics and generating better data, putting better values on people, and finding value in people that they themselves don't know they have because the society has told them they don't have it, that's an incredible story. So I think that's, if I was gonna like create a North Star for a data analyst, it would be that. It would be, how do we find truth? How do we find knowledge that enables us to make better predictions about things? And not how do we use it to make it all so complicated that everybody thinks we're important, even though what we're doing is basically evil. That's what I would say.
Yeah, excellent. Really like those thoughts. It's basically, first of all, the moral dilemmas don't go away because you're using a lot of data, and you highlighted a few examples of data for good that others should emulate. What a great way to close things out. I do have one more question. And I actually want to mute Michael. I don't know if I can actually mute you, Michael, but you're not allowed to answer this question. This is only a question for charity. And I don't want to hear anything from you.
Uh-oh, now I'm nervous.
The question is this. So I am in the unique position of being able to interview both the author and the protagonist of the book, of what's allegedly a nonfiction book, although it reads as such a compelling narrative, one has to wonder. And Charity, I'm curious. So you're depicted in this book. It goes into all kinds of details of your personal life and what you did and what you didn't do. How embellished is the book? You know, is this more or less how it happened, or is there some creative liberties taken by Michael?
Everything that Michael Lewis wrote about me is true. And in fact, because he's a gentleman and wanted to tell the story in the right way, he even left out some of the gnarlier details that he could have included. But everything in there is true. It's not embellished, not about me. Everything that I know, and I opened up my life to him, and he got to know me and public health and microbiology really well. It's all true.
Yeah, awesome. And you know, it's such a fascinating narrative that just reading it, you know, I had to think, you know, man, did it really happen this way? It's such a sort of remarkable story. So I think we will close with that. We're out of time. Thank you so much to both of you. Any final words to say to the data science community?
I have a few final words. I would say, to Michael's point, get engaged in the solution, that the solution sparkles with hope. And it's been a hard 18 months. And in whatever capacity you can, get engaged with what the solution might be, not just for the United States, but for systems around the world, because we can do this better.
Yeah, awesome.
Can I add to that? Can I add to that? Because this audience is actually the perfect audience to know a statistic that tells them what they should do. In the federal government right now, in information technology, there are 5 times more employees over the age of 60 than under the age of 30. There are 19 times more employees over the age of 50 than under the age of 30. That there is a generation waiting to arrive in the federal government. And it doesn't have to be like lifetime service. It's like, I can go work there for a couple of years to repair these structures and to figure out how to use them to generate data that can be used to make decisions. It's just waiting to happen. And I think that a sort of sense that if you're the kind of person who has a gift with technology, particularly using technology in data related matters, that if you start thinking of your government as something you jump into rather than you watch, don't be a spectator, jump onto the field.
Yeah.
I think you'll find, this is gonna sound strange, I think you'd find openings on the field and you'd be allowed to play.
Yeah, for sure. And I think DJ Patil is another speaker at this conference. He comes up in the book as well, but you know, he's someone who is a well-known data science leader in the private sector and went on to do a lot of interesting things in the public space. And I think it's an inspiring story for any of us in this area, that we should seriously consider it to our duty or how we can contribute in the public sector. Thanks so much to the two of you, and looking forward to staying in touch.
Thank you, Patrick.
Bye, everyone.
Bye-bye.